There you go. Hi, I'm Dr. Wendy Wagner, and I am doing some additional ObGyn topics. I haven't done any videos in a while, so today I'm going to be talking about Group B Strep. It is a test that we do at 35 to 37 weeks of pregnancy, and some people don't have the full understanding of what it is or what the treatment is, so I'm going to try to straighten that out today. So, Group B Strep is a bacteria that some people's GI tract are colonized with. It can be intermittently colonized, and that's why we do the testing for Group B Strep at the end of pregnancy. The reason that we do the test is that women that are colonized at the end of pregnancy need to be treated in labor in order for babies not to be affected/infected with Group B Strep. Years ago, it was found that women that were colonized with Group B Strep, some of their babies would be infected after vaginal delivery. Few babies were infected, but the infection can be so severe that babies can get very sick and even can die from this infection. So, for many years, we've been testing women at 35 to 37 weeks of pregnancy. Between 20 and 30% of women are colonized with Group B Strep at the time of delivery, and the hope is that we've tested those women and all of them are treated at the time of delivery so that the babies don't get infected. So at about 36 weeks of pregnancy, women get a test for Group B Strep. It's a very simple test. What it is a swab, what we call a vaginal rectal swab. So it's just a cotton swab. The lower portion of the vagina and the rectum is swabbed for Group B Strep. That is then placed in this media and sent to the lab for either positive or negative result. No speculum is used for the exam. This exam is done before any internal exam or anything like that is done. When the result comes back, it's either positive or negative. The only difference in testing is if somebody has an allergy to penicillin or ampicillin, which is what we use to treat Group B Strep with in labor, then sometimes we do testing to see if other medications can be used. So, if you're positive for Group B Strep, then you get antibiotics in labor. The only thing that's going to be different is through the IV, you're going to get antibiotics every 4 hours from labor or rupture of membranes to delivery. The only thing that may be different is that your provider may tell you, if you are positive for Group B Strep, to come in a little bit earlier in labor if you broke your water, because there is an advantage to getting 4 hours of the antibiotic or 2 doses of the antibiotic before delivery. If you're having a scheduled C-section, haven't broken your water, you don't need any treatment for Group B Strep. The other time that we treat for Group B Strep is quote-unquote preterm, so anybody who delivers before 36 completed weeks, regardless of the Group B Strep status, is treated for Group B Strep. If the status is unknown, we treat until the status is known. So in other words, if somebody either is in preterm labor or their water's broken prematurely, then we treat them until the result comes back. If they're negative, then we stop that treatment. Alright, so 3 quick points. First one being that even if you have a scheduled C-section, or C-section that you have scheduled, and you are not expecting to have a vaginal delivery, we still do the Group B Strep culture. The reason is that if your water breaks before delivery, and you need to get treatment, or it needs to be known by a pediatrician what your Group B Strep status is. 2 other important points where you don't have to have the Group B Strep swab done at about approximately 36 weeks, and that is the times when you're automatically treated for Group B Strep. These times are if you've had Group B Strep in your urine during the pregnancy. So if the first visit for your pregnancy, Group B Strep was shown, whether or not you were treated for this, you're automatically treated at the time of delivery, so you don't need the swab done. The other circumstance is if you had a baby that was affected by Group B Strep, so had a Group B Strep infection in the past, you are automatically treated for Group B Strep during labor and delivery because of the increased risk of this infection. So, you will get the testing done. Hopefully you'll understand about the result and about the treatment and the reason that we do it.